Welcome to the September project update for the Caregiver Supports Project. I'm Jessica Larson, the project manager. DCYF will post a new project update on the last Thursday of each month. The August 2023 presentation is currently posted on the DCYF Thriving Families website. The Caregiver Supports Project aims to implement a continuum of placement resources that enable safe, stable, and supported placements for children and youth in foster care. There are two phases of this work. In Phase 1, DCYF will replace the existing 4-level rate assessment system with a 7-level model that is based on the needs of children and youth in care. In January 2024, DCYF will implement the new 7-level payment structure and start paying the new foster care level payments for licensed caregivers. Phase 2 of the Caregiver Supports Project is the implementation of a new Caregiver Supports contract to provide placement supports to both licensed and unlicensed caregivers. Case aids will be part of the placement supports available for caregiver supports levels 3 through 7. The caregiver supports contracts will be awarded to providers through a bidding process, and the placement supports will be phased in starting in spring 2024 through summer 2026. The supports will roll out according to an implementation plan that is based on capacity to provide services and allowed legislative project funding for the next couple of years. The Caregiver Supports Project is part of DCYF's Thriving Families campaign. Thriving Families is made up of multiple projects and initiatives in the child welfare space that focuses on prevention, supporting families and staff, and strengthening practice. The projects, including caregiver supports, are listed on the Thriving Families website along with links to fact sheets about each project. In today's presentation, I will focus on updates related to Phase 2 of the project, which is implementation of the caregiver support contract that enables placement supports for all caregivers. I will share the caregiver supports contract provider rates and review the catchment areas and proposed plan for rolling out the contracts to the catchment areas. Before going into details of Phase 2, I will go over some elements of Phase 1 of the Caregiver Supports Project. The August presentation on the DCYF Thriving Families website under the Caregiver Support section goes into more detail about Phase 1 and the caregiver support level determination process. Phase 1 will kick off in January 2024. At that time, DCYF will replace the current 4-level rate assessment system with a 7-level caregiver support model. Each support category is associated with a level of caregiver supports. For licensed caregivers, each level is also linked to the foster care reimbursement rate. The caregiver supports are meant to meet the needs of the children and youth in the different support needs categories you see here in the model. The Caregiver Supports Project will include a big change to the way rate assessment is currently done. The caregiver support levels are designed to align with the diverse needs of children and youth in care. This means that DCYF will focus on identifying those needs rather than asking caregivers to report time spent caring for a child. This is an objective way to ensure supports are available for caregivers caring for children with a variety of needs. Starting January 1st, 2024, the current rate assessment process will stop, and DCYF will no longer contact the caregivers within 30 days of placement to complete an assessment. Instead, DCYF has developed a tool that will be used to determine the caregiver support level for each child. The caregiver support level is based on the needs and characteristics of the child, informed by research completed by DSHS Research and Data Analysis Team, also known as RDA. Starting January 1st, 2024, DCYF will use this tool to make caregiver support level determinations. The caregiver supports level also informs the level of service contractors provide to licensed and unlicensed caregivers under the caregiver supports contract that will roll out as part of Phase 2 of the project in 2024 through 2026. Caregiver supports contracts will be awarded through an RFP process. Contracts will be awarded based on designated geographic catchment areas. Each catchment area will have one contract awarded, and that provider is responsible for serving all families within the catchment area. The proposed catchment areas will be shared in a later slide. Implementation of caregiver supports contracts will be a phased rollout. This is necessary to ensure providers have capacity to serve catchment areas and to align with the funding allocated by the legislature. The contracts will be phased in statewide by 2026. The Caregiver Supports contract will provide 2 areas of services to caregivers: placement supports and case aids. Case aids are available for caregiver support levels 3 through 7 as funded by the legislature. Placement support is a service offered to every caregiver, support levels 1 through 7. This service is built to assist caregivers to identify and access resources that support them in caring for children and youth in their home. The level of placement supports will go up as the needs of the child or youth go up. Support areas include accessing resources such as education advocacy, health and well-being coordination, finding local childcare, culturally and developmentally appropriate care, transition to adulthood, and crisis supports. As stated before, the Caregiver Supports Contract is related to placement supports for the caregiver and not direct provision of services to the child. The purpose of the Caregiver Supports Contract is for providers to help ensure caregivers have access to the supports that they need to care for kids. DCYF anticipates starting the phased implementation of the Caregiver Supports Contract in spring of 2024, with the procurement process starting late this year or early 2024. Here's a map of the 14 Caregiver Supports catchment areas with boundaries in red. As stated in the previous slide, Caregiver Supports contracts will be awarded through an RFP process, with contracts awarded based on designated geographic catchment areas. Each catchment area will have one contract awarded, and that provider is responsible for serving all families within the catchment area. Tribes will have the option of serving their own families should they choose. Separate outreach and communications about the Caregiver Supports Project will take place with tribal partners through the Office of Tribal Relations. Child placing agencies will also continue to serve the homes they certify for licensure. These CPA homes will not be included in the catchment area populations. The rates for the Caregiver Supports Contract are regionalized, meaning they differ based on geography. Regionalized rates better reflect the costs incurred by local providers and are a more fair way to pay for services than using an average for all areas. This table shows the rates paid in the 4 different regions identified by DCYF. To the right, you can see which catchment areas are in each zone. Hourly case aid rates for each region are listed at the bottom of the table. Case aids are available for levels 3 through 7 and will not require a referral in the new model. As mentioned previously, the implementation of Caregiver Supports contracts will be a phased rollout, which is necessary to ensure providers have capacity to serve catchment areas and to align with the funding allocated by the legislature. The contracts will be phased in statewide by 2026. The Caregiver Supports contracts will roll out by catchment area. DCYF used the guiding principles on this slide to determine the order that contracts will roll out to catchment areas. The placement supports provided via the Caregiver Supports contract are intended to increase placement stability and allow kin caregivers access to supports they do not currently have today. So that is why these data points are included as guiding principles. Additionally, DCYF determined it would be important to consider the ability of providers to build up their capacity to provide supports, and areas that rolled out sooner would be in a good position to do this to inform later implementations. Legislative funding for 2024 through 2026 is also a limitation that had to be considered. DCYF used data to identify catchment areas with the highest level of placement instability and the highest percentage of kinship caregivers. Each catchment area received a score 1 through 14 for each of these data points, and they were cross-referenced to create a rank order. The rank order was then adjusted to ensure that provider capacity was accounted for or that service deserts did not roll out first. The result of the analysis is the proposed catchment area rollout order that is listed on the right. The next step is to finalize the order will be to do an analysis to ensure that it would be feasible within the parameters of funding allowed by the legislature from 2024 through 2026. Both catchment areas in King County, King North, and King South will roll out at the same time, although different providers may bid on and be awarded the contracts for the separate catchment areas. The same goes for the catchment areas in Pierce County, Pierce East, and Pierce West. This is due to administrative limitations in the payment system that make it a challenge to roll them out separately, although this order is also supported by the guiding principles. The actual timeline for rollout has not been determined, as the project team must do more analysis to understand internal staffing needs and capacity to support procurements and implementation. DCYF expects a learning curve for the first procurements where more time may be necessary to execute contracts. Over time, implementation may become quicker as best practices are established and lessons learned. Typical procurements are 45 to 75 days, but could be longer. DCYF expects to release a request for information in October and accept responses until the end of the month. DCYF sends out RFIs to anyone signed up for the distribution list. The next project update will be posted on the project website on October 26th. Here's the calendar for project updates for the rest of the year. If you have any questions or comments about the content in this webinar, please email the Caregiver Supports Project inbox at dcyf.caregiversupports@dcyf.wa.gov. Thank you for reviewing this presentation, and we look forward to sharing additional information next month.